Welcome to the NPTE Final Frontier podcast, helping one student at a time. Visit npteff.com to enroll today so you can pass tomorrow.
Thank you for joining us here on the NPTE Final Frontier podcast. My name is Emily, and today I will be diving into a practice question involving sacroiliac joint special tests, or more commonly referred to as the SI joint. A physical therapist is evaluating a patient with suspected sacroiliac joint dysfunction. To improve diagnostic accuracy, the therapist selects a group of special tests. Which of the following test clusters would provide the highest reliability for confirming SI joint involvement? Option A, sacral thrust, prone instability test, and thigh thrust. Option B, Gillette's test, compression test, and Stork test. Option C, sacral thrust, thigh thrust, and Gainsland's test. Or option D, Stork test, slump test, and palpation of bony landmark asymmetry. All right, warriors. So the most evidence-supported cluster for sacroiliac joint dysfunction includes provocation tests that reproduced the patient's familiar pain. According to Laszlo et al., 3 or more positive provocation tests out of the 6 would indicate an SI joint pathology or dysfunction. Now, this cluster includes the following: thigh thrust, sacral thrust, compression, distraction, and Gainsland's on the left and right side. Now again, these target the SI joint mechanically and would provoke pain in symptomatic patients. Now, with that being said, the correct answer choice for this question is option C, because option C included sacral thrust, thigh thrust, and Gainsland's test, which are 3 of the tests that are all a part of that SI joint cluster. Now let's look at the other answer choices and look for the distractors. So in option A, there was also the prone instability test. Prone instability is for lumbar instability, not sacroiliac joint. So we can cross off option A. Option B included Gillette's and Stork, which are palpation tests that are less reliable and lack as strong of evidence. So we can cross off option B. And option D, slump test, assesses more for what? Yep, it assesses for neural tension. And bony landmark asymmetry is subjective, which kind of poorly supports SI joint diagnosis. Now, always be mindful and always be looking for distractors in the question stem as well as the option choices to always make sure we're selecting that correct answer choice. So again, the correct answer here was option C, because remember, those sacroiliac joint cluster special tests include the thigh thrust, sacral thrust, compression, distraction, and Gainsland's on the left and right. Great job, warriors. Here's a quote by William James. "The greatest discovery of my generation is that a human being can alter his life by altering his attitude." As students, it's so easy to measure success by grades or milestones. But true growth comes when you recognize how capable you already are. Keep going, warriors. You are further along than you think. You are powerful. You are strong. You are a final frontier warrior, and you will pass. Thank you very much for listening. For more information on the NPTE Final Frontier, please visit npteff.com. You can check out all of our social media platforms such as Facebook, Instagram, Twitter, and TikTok. Have a great day and a powerful tomorrow.